Welcome to the 2012 National Kidney Foundation meetings. I'm Tejas Desai from eAJKD, the official blog of the American Journal of Kidney Diseases, and I'm joined by Dr. Mala Sachdeva from North Shore Hospital, Hofstra, North Shore LIJ School of Medicine. And we're here to talk about her research in living kidney donation barriers and specifically obesity. Dr. Sachdeva, welcome.
Thank you.
So tell us a little bit about your investigation.
Sure. So I guess, let me just start off by giving you a little bit of background into, how we even came about with this study. We all know that at this point in time, per UNO's data, there are about 92,000 candidates on a waiting list for the kidney transplant. And every day we're losing about 10 people due to their waiting list. Now, we have a shortage of kidneys in terms of deceased donor kidneys, and so we tend to favor more and more living donation. We, however, do have a shortage of living donors as well, and part of the reason is because of the stringent criteria we place on our living donors when they come for their pre-donation evaluation. They go through very stringent criteria. We have to make sure that they don't have any, history of high blood pressure, diabetes, any other metabolic derangements, and obesity as well. So obesity does serve as a criteria for exclusion in our potential living donors, and about 50% or more than half of our transplant centers are excluding donors based on BMI, and they're excluding donors who have a BMI greater than 35. So that's what kind of led us to do the study, in the sense we wanted to actually classify any potential living donor that came into our transplant center between 2008 and 2011, and we wanted to see what their BMI was. So we wanted to categorize them according to BMI, and of those who were excluded, we actually wanted to also see were they successful at losing weight and then donating, or were they not successful?
Now, I took a look at your abstract and your data, and I found it very interesting that you were able to identify in a retrospective manner the percent of individuals who were excluded with because of a high BMI over 35. But then you did something interesting at your institution. Why don't you tell us about it?
Correct. So, essentially what we found through our study was that, and it was pretty surprising, that around 82%, and this is out of 104 potential living donors, 82% spanned the overweight to obese categories. So basically, only 18% had normal BMI. Now, of those 82%, 45% were obese, meaning BMI was above 30, and of those, 22% were having a BMI greater than 35, and those were the ones who were excluded. So we had 23 of the 104, or 22%, who were excluded based on their BMI greater than 35. So what we further did then was we wanted to see what were the results and what happened to those 23 patients who actually were excluded based on their BMI. So what we found was that, after they meet with a dietitian, after they are instructed on lifestyle modification and different dietary modifications as well, we found that 13%, which was 3 of the 23, were successful at losing the weight and donating, but there was still a huge number, 30%, who were not successful at losing the weight, although they were trying and they were motivated.
Now tell us where you and your research group go next. I presume that you'll be looking at that 30% that have been unsuccessful at losing weight but are still motivated to donate a kidney. But tell us a little bit more about what we can expect in the future.
Correct. So, from this study, we took home that basically one thing is obesity is definitely a barrier to kidney donation. It's definitely a barrier at the local level, probably a barrier at the national level. Further studies probably need to be done in order to see this. In order to increase our number of living donors, I think we need to address the obesity issue. Now, then the question is, whom should we target? And what should we do? And I think the ones who we should target in terms of those that are excluded based on their BMI are those 30% that we found who had the motivation, who wanted to donate, but who were unsuccessful. And I think those are the ones that we need to target more. And how do we target them? I think possibly we can target them through some, maybe more close follow-up at the transplant center. Other things we can do is offer them bariatric surgery if their BMI permits. We can offer them to enroll in more rigid weight loss programs, or even have some kind of motivational support group meetings for them. And so I think, at our transplant center, we're currently looking into, some possible demographic variables which may help determine which ones were the successful ones, which one were the unsuccessful ones. And number two is maybe try to implement some programs that will help us target this 30% who were not successful but had the motivation to try to increase the number of living donors.
That sounds great, and I want to thank you for sharing your data with us and here in the NKF community. We wish you all the best, and we think this is absolutely necessary, a necessary investigation and a necessary endeavor if we want to increase the number of living kidney donors that we have. And thank you for joining eAJKD at the 2012 National Kidney Foundation meetings.